Welcome to this how-to guide on how to immobilize a wound to promote healing. My name is Patrick Pollock and I am a specialist in large animal surgery. The purpose of the veterinary high performance how-to guides is to provide guidance to help those who are treating various conditions in large animals to optimize their outcomes. We're very happy to provide help and advice about clinical cases. Please contact us if we can help in any way. Why on earth would you choose to immobilize a wound? Well, of course, there are lots of reasons to cover and immobilize wounds: to support moist wound healing, which promotes healing, to help keep dressings in contact with the wound, to facilitate debridement and removal of bioburden, all of the various things that are on the surface of the wound, including bacteria, necrotic tissue, organic tissue and fecal material, and all the things that come into equine wounds in the environment. It might help us to remove bioburden to facilitate delayed closure and to protect other underlying structures that might be involved. We know that when we immobilize tissue, we increase the rate of contraction. We start to facilitate the deposition of collagen to make the wound potentially stronger, and this will help to allow granulation tissue to form, which will enhance the wound's resistance to infection and also help to support instability that might be present because of other damage to the tissues around. But of course, we've all come up against clients and owners and keepers of animals who will feel very strongly that wounds are better off out with the air in and around them. And of course, we know that once we cover a wound and keep it moist, we will increase the rate of epithelialization. So lots of good reasons to keep a wound immobile. Movement is perhaps, of all of the many impediments to healing which are present in the environments and on the horse and in the areas where we keep horses, movement is probably the most important one. And excessive movement, as particularly occurs over joints or bony protuberances, such as the point of the hock or at the fetlock, will make a big effect on the wound. And here's an example of a wound which is in a horse in lateral recumbency in the operating room. And the lower leg of this horse is being flexed and extended, and what you can see is this big pad of granulation tissue which is stuck onto the extensor tendon, which is moving up and down through the wound. And you can imagine then the possibility of the tissue being able to move over the surface of that, and the granulation to cover and seal that defect is going to be very hard because of that movement. We know that total lack of movement can lead to a weak scar, so some movement at certain points in the healing cycle is really important. But the trick is to reduce or eliminate, if possible, the movement that's occurring during the repair phase of healing when this new tissue is being laid down. How can you tell that movement is the issue? Well, the first thing that we must all do when we're faced with a wound is to look at that wound and look at the environment and look at the animal and really try and determine what impediments to healing might be present. And let's just get one thing straight. There is no cream, there is no bandage, there's no dressing. There's no magic treatment that allows you to ignore the impediments to healing. And there are 12 of them written out: infection, the presence of foreign bodies, necrotic tissue, loss of blood supply, poor oxygenation to the tissues, a big deficit, trauma that's continuing, local factors present in and around the environment of the wound, the health status of the animal, transformation of tissue, and of course, those old iatrogenic factors. Those are the things that we do that sometimes delay or impede healing. But there's number 4, movement. And signs that movement might be the issue include things like wounds that should heal, that you think should be healing, and we know there's a known rate of healing. We know that wounds will epithelialize at a speed of 1.2 millimeters per day. So we can look at the length and the size of the wound and do a calculation and determine really how quickly that wound will heal. So if there's prolonged healing, if there's complicated healing, if there's the presence of excessive granulation tissue, hypergranulation tissue, wounds that are not contracting, and when we've got structures moving through the wound, as we saw in that last video. So how do we deal with excessive movement? What are the options to immobilize that wound? Well, we could use multi-layer bandages, and the best example of that would be the Robert Jones bandage. And look out for another how-to guide on how to place a good Robert Jones bandage in a horse. We could incorporate a splint into those multi-layer bandages, and we can make splints out of a variety of different materials, and again, look out for a how-to guide on that. And then we've got placement of something like a bandage cast or a cast itself, and that's very much going to be the subject of the discussion we have here today. Couple of things to ask yourself before you get involved in this. Do you know how to place a good bandage? Do you place a bandage often? Do you practice that on a horse that doesn't have a problem? Do you have complications when you place bandages? What are those complications? Do you record them? Is there an audit trail to look for those? And does everybody in your group bandage in the same way? In fact, there are lots of ways to bandage, and what you really need to do is find a way and stick with it. This is the way that I usually like to bandage, by holding the dressing in place with some sort of conforming orthopedic material. We then place a padding layer, cotton wool or gamgee, and over the top of that we would place an open weave bandage which is pulled tightly. And over the top of that then a conforming cohesive bandage would be the next thing to do. And then at the top and the bottom of the bandage, an elastic adhesive bandage such as Elastoplast would work very well. We know that in horses, in stark contrast to some of the other domestic veterinary species, that a tight bandage is much safer than a loose bandage. So creating a column of uniform tightness from the bottom of the limb to the top of the bandage is absolutely critical. In the past, we have believed that making cuts at areas in the bandage, such as over a bony tuberosity, would be helpful at reducing the pressure over that specific area. But we know now through evidence and research that in fact the effects on the pressure over that particular area will be really quite variable, and it can in fact add to pressure in other places. So it's best not to make those cuts in a bandage. What we're really talking about here to immobilize a wound is total immobilization, and that is through the use of a cast or a bandage cast. So that's going to eliminate movement, to compress the wound and to protect the wound. And the options are going to be a full cast, a cast over a bandage, a bivalved cast where we've put a cast in place and then cut it off and put it back on again, and then using half a cast as a splint. Really important point here, placing a good cast is a skill. Takes practice, and sometimes unfortunately you'll place one that doesn't really work. The animal will be walking poorly in it, pivoting on it, and you'll just know that that cast is going to cause you problems. And really you have to be brave in those situations and stop and take the cast off and replace it. You're going to require a variety of bits of equipment and consumables in order to perform this. You're going to require the material to place a bandage, and then for the cast itself you're going to require stocking net, orthopedic felt, and a polyurethane resin impregnated fabric or cast material. And there are many different types available wherever you may be in the world. Most of these veterinary casting tapes have a very similar construct. They're activated by water, and what happens when you place a cast is that these layers laminate together to basically form one construct. And that's really important because when you put them on, we need that curing to happen at the same time so that everything sticks together. Otherwise we'll have multiple layers which are moving against each other and the cast won't be strong enough. These materials cure quickly. They're designed for people in a hospital situation. It's a very different environment to the environments where we're casting large animals. So despite what it says on the instructions, for equine casting, use cold water. That will slow down the process and allow you time to get the entire cast on before the significant curing takes place. There are many ways to cast a horse, and what I would really suggest is that you pick a technique that works for you and you stick with it. In this case, we've got an acute, heavily contaminated wound, as you can see. This wound has got granulation tissue present and some epithelial margin cells, that white margin around the edge, and that means that we know that this wound has been present for at least 10 to 14 days. It's going to be difficult to close this wound immediately, so in this case we undertook a technique called delayed primary closure, and look out for a how-to guide in order to do that. This animal was treated for 24 hours. As you can see, just preparing this tissue carefully, removing the superficial contamination, the hair around the wound, and then cleaning the wound using, in this case, hydrosurgical lavage, and then the wound at this point was subjected to closure. This wound was placed in a cast for 14 days, for 2 weeks. And you can see here at the point of presentation on the left, and then after the cast was removed on the right at 14 days, we've got a wound which is healed. We've got a couple of areas, small areas still to contract and granulate, but generally speaking, we've made a big difference to this wound, and we've really reduced the time that this animal is going to require bandaging for. So the value of immobilization is here and clear to see, but how do we do it? In order to place a bandage cast, we are going to place that wound dressing over the surface of the wound itself, and then we're going to place a bandage over the top of that. So we're rolling our stocking net, which is going to go underneath the bandage and the cast, and get that rolled up and over the limb so that we're covering all the areas. And the value of this will come later on. You need a bit of help to do this. This horse is obviously lying in lateral recumbency, and I'm very grateful to my friend and colleague Anhad Singh Sidhu, who is placing this cast for us. And you can see just making sure that that is nicely placed and sitting where we need it to be. Run this video at the same time, and this is for the top of the cast where we're placing some orthopedic felt. This is a material which there's a variety of different versions of this, but it's got an adhesive back, and it's a padding layer that won't settle, and that's then placed at the point where the cast is going to finish. And what we're going to do with that is we're going to overlap our cast onto about 50% of that, and we'll usually place some of that at the lower end of the cast as well, over the coronary band, just to protect that sensitive area. We're then going to place a nice snug bandage over this limb. Remember, this is a bandage cast, so this is a cast which is placed on top of a 1 or 2 layer bandage usually. Placing a bandage is a great skill. It's a skill that you need to learn to make sure that you're able to do it effectively. You need a nice uniform layer here. You see we're trying to create a column of compression here, which will make this bandage more comfortable, and it will also make the whole construct as strong as it can possibly be. The next layer is going to be our open weave layer. So this is a white open weave bandage. We can pull this quite tight. We're looking for a uniform tension across that. So as you can see, as this is being pulled on, it's being pulled relatively tight. And I'm going to say that it's quite difficult to make this too tight in a horse, which of course is in stark contrast to some of the other veterinary species that we deal with, particularly the small animals, in which really we can cause some damage, some pressure necrosis from an over tight bandage. And as you can see, as this is being placed, then the bandager is just rubbing the bandage, just working out any kind of lumps and bumps, again just trying to make that tension as even as it possibly can be. So we're just getting that nicely placed, just so we've really got this nice uniform tension across the surface of the bandage. So getting that layer placed really, really nicely. Super. We're going to go with a second layer of open weave bandage again. That's just going to give us the type of compression that we're looking for. So even compression. We don't want a banana. A banana shaped bandage is going to be problematic. That's going to be very uneven in terms of its tension, and that's absolutely not what we're looking for. So continue to place this. Our next layer is just coming now, and that next layer is going to be our adhesive, our cohesive bandage, which is going to stick to itself. There are so many versions of that bandage available, and those bandages, you can't pull them too tight because they break. But one of the tips and tricks when you're placing that is it's got a kind of a pattern on the surface of it, and it will lose that pattern if you pull it to more or less the right tension. So here that comes now, that green bandage coming on. This is a cohesive dressing, sticks to itself really nicely, and that's going to be pulled on. And that's an important layer. You might think it's less important under a cast, but one of the great things about this layer is that the cast material itself won't stick to this layer, and that will just help you a little bit when it comes to removal of the cast, because obviously removal of the cast can be quite challenging. So we're pulling this up nicely now and getting ourselves to the stage where we've nearly got our bandage placed, and we're nearly at the point where we can place the cast itself. You can see great care has been taken to overlap by about a third to a half. And you can see just how tight that's being pulled. It's losing its pattern on the outside. Now the cast itself. So we've got a number of people here. We've got the person who's holding the limb. This is a hind limb cast. And what we really need is this limb extension. In order to get that limb extension, we're going to want to have some pressure on the stifle and somebody extending the toe. We've got somebody else who's preparing the cast material, so they're immersing that in water, giving it a nice squeeze, getting rid of the superficial water, and then handing it to the person who's actually applying the cast. We're overlapping again, just like we did for the bandage material, to about 1/3 to 1/2, and we're pulling quite tight. In this case, we're trying to create a lovely column of material, and we want to make sure that we get this on before the cast begins to laminate, because again, we want everything to stick together, these multiple layers of cast to stick together as far as we possibly can. So once we get to the end, we're going to be saying to the person who's helping us, who's getting the next bit of casting material ready, so that really that's going to come to your hand. This is a team effort, and we need everybody together. See, there we go. We've got the next layer ready to go, and so that's being placed. And in order to make sure that we've got enough strength to resist the various forces that are going to be placed upon this limb, we're going to need between 5 and 6 layers of casting material. And you can see the person who is holding the limb in the right position, they need to really keep that limb in the right position, and the caster is working around them. We don't want lots of micro movements which are going to lead to movement inside the cast and the cast being expanded before it has had a chance to fully set. So again, we're coming up very nicely, overlapping by 1/3 to 1/2, and you can see that we're choosing to stop this cast at about halfway up the level of the orthopedic felt that we placed before we started the casting. So that's layer number 2, and then we're moving to layer number 3, and you see it's being beautifully passed. So we're making sure that we're optimizing the time here. We've got a perfect team working together to make sure that we get this cast on before the lamination process begins. How do you know it's laminating? It makes a bit of a noise. We start to get kind of bubbles at the surface of the cast, and you'll also feel the warmth of the cast. This is an exothermic reaction, and you'll feel that coming. Now, in a half limb cast here, we're going to need some sort of wedge onto the toe. That's going to allow the horse to walk flat-footed, which is important. It's going to massively improve comfort, and it's going to reduce the risk of cast sores developing on the front, on the dorsal aspect of the foot, by giving us this foot that we're putting in place. So we're going to cast that on, and we'll come back to talking about that as we look at the various materials that we're using once we've seen the cast being placed. So that's being incorporated into the cast. That's layer number 3 now. So we're moving well, and we're getting through this nicely. And you can see all of the time the person who's holding the cast is making sure that they're holding this in the right position, that they're not allowing the person who's casting to flex and extend the leg to any great extent. Obviously impossible to completely eliminate that, but they're doing their best to hold it as best they can. Next roll of casting tape, roll number 4, is being applied. You can see he's always going back to the beginning, back to the starting point. We want to make sure that we've got an ample thickness of cast material up at that level there, and we're going to keep placing this as best we can. So on it goes, rolling down, making sure that we've got all of the layers that we need. Limb position is absolutely critical. Getting this limb position right at this point is really important. And you can see we've got the beginning of lamination there. We've got these bubbles on the surface of the cast. There'll be a little bit of noise there if you're standing there, and we'll see we'll feel some heat as the cast begins to laminate to itself. So that's going to really start to cure now. So we're at layer number 4, and we want to make sure that we have got enough layers on there as the lamination process begins. So looking really nice. You can see that lamination there, so you know that's kicking off. At this point now, before we place our last few layers, we're going to grab the stocking net and pull it down. That folds the orthopedic felt over the top, and that creates a soft padded area at the top of the cast, which is going to reduce the risk of a sharp area there, which might cause a laceration or irritation to the skin. You can see now placing casting material to hold that stocking net in place, and we've got this nice padded area at the top of the cast, which is really going to protect that top part there of the horse's limb. So that's being pulled on. That's now going to laminate in as the lamination process is really well underway at this point. So we need to make sure that we've got this on, and we are nearly finished. So layer number 5 in this case being placed onto the cast. You can see, of course, there's a couple of important points in terms of what you're wearing when you're doing this. So we're certainly going to wear surgical gloves or nitrile gloves. The cast material is a bit irritant. It sticks onto you, and it's quite hard to get off. So make sure that you're not making that come into contact with your skin, and you're taking every effort to protect yourself from that. It's not at all toxic, but it is a bit irritating, and it's quite rough if it sticks onto you, so you don't want that to happen. Good. So layer number 5 has now been applied, and it's just being stuck on there. And then usually at this point we'd spend a bit of time just giving the cast a bit of a rub, just to spread around that lamination, spread around the fluid that the edge of that cast is inclined to fall off. So you need to hold that in place so it sticks on nicely. We're then at the point of the top and the bottom of the cast. We talked already about placing a wooden wedge. A couple of things are important about that wooden wedge. That wooden wedge needs to be made of hardwood. Softwood will break in two or more pieces, in fact, so hardwood. And we have a selection of wedges which fit whatever size animal you're casting. So we just have a box of these, and you can work out then when you're putting the cast on, just to get the lift right so that you're creating a flat walking surface. The toe needs to be protected. We're going to protect the toe either with some polymethyl methacrylate resin or some cotton and thermoplastic resin. And you've seen what we do with the stocking net at the top of the cast, which allows us to reduce the risk of a rub or an abrasion at the top of the cast. The top and bottom of the cast we protect with either polymethyl methacrylate resin that can be bought from a veterinary wholesaler. This is actually cotton mesh which has been impregnated with non-toxic thermoplastic. It's sold in the UK as Vetlite. It's a very effective material. It's very hard wearing. If you don't place something on the bottom of the cast, particularly around the toe, the animal will wear through that within about 24 to 48 hours. The cast will become loose and the risk of cast sores is high. This material requires to be activated in boiling water, or certainly close to boiling water, and so we place that quite carefully, and if we don't have it nicely melted, it won't adhere and it just falls off again. So you got to pull it off and reactivate it in boiling water and place it back on again. So you can see the next piece will be coming very shortly, and we're just making sure that we layer it up nicely over the whole bottom of the foot. So multiple layers passed all around. Obviously areas, if the horse is rubbing that foot, it's going to do that and scrape mostly at the toe, so a bit of extra material at the toe can work well. And some people combine that non-toxic thermoplastic with the polymethyl methacrylate resin. Polymethyl methacrylate resin on its own is a little bit smooth, and it can make the distal end of the cast a bit slippy. And of course, now the cast is on. Is it a good cast? Well, you can't really tell that until the horse stands and the horse walks. But signs that it's a poor cast might be the animal pivoting on the cast, a big disparity in limb length, and we'll talk about how to manage that in a moment or two, a gap at the top, so when the animal walks, a big gaping area at the top where material could get down, or animals that stand with an odd posture, either the limb held a long way out behind them or a long way in front of them, or animals that don't want to weight bear at all. We always place a boot on the other foot so that they have a limb length of the same length on each back leg, and we put elastoplast around the top of the cast. You can see that in this top picture here, and we change that every day to make sure there's no swelling there and nothing is going down. What sort of things go wrong with casts? Well, they break, they split, they fold. That may lead to lameness, it can lead to rubs. These are big issues and you've got to watch out for them. On the front of every stable in which we have a casted horse, we have a cast checklist, and we every day, twice a day, undertake the cast checklist, making sure that we've got no signs that that cast is in any way damaged, is making a funny noise, has got folds or splits or cracks in it. And we must check these areas out to make sure that nothing is going wrong. Most casts will fail in bending. and the strength of the cast will be determined by the compressive strength of the material that you're using. These materials, as we mentioned already, are resin materials, and the quality of the lamination is determined by how much you overlap and how quickly you get the cast on. You don't want to use casts or materials of different types, so all from the same manufacturer for the same cast, and making sure you've got enough thickness. So 5 to 6 different rolls is going to make a big difference for a standard half limb cast. Of course, if these animals have casts placed when they're under general anaesthesia, the biggest risk to that cast is going to be in recovery from anaesthesia, and that's going to be sort of in the half hour to 2 hours post application. Many of these lower limb casts will fail around the lower limb joints, particularly the metacarpal and metatarsophalangeal joints, the fetlock joints. And some examples of wounds which are very well suited to casting. Here's a wound involving the dorsal aspect of the hind limb, the metatarsal region. The extensor tendon has been lost. What you can see has been done here is this wound has been thoroughly debrided and cleaned, and the extensor tendon has been closed. It's been brought back together, in this case using a locking loop suture, and then the wound itself has been closed, and you can see in the bottom right hand corner we've got this wound closed. Now if we recover this animal in a bandage, even a multi-layer bandage with a splint, this wound will be subject to excessive force and it will break down. And so what we're really looking for is a cast to support that wound, and we'll show you that animal in just a moment. We're going to monitor these casts very carefully every day, and that's going to involve twice a day moving the animal, getting the animal to walk. It's going to walk a good distance. It's going to be a positive walk. We're not going to walk slowly. We want to see how this animal's moving, where it's placing the foot. You can see in this animal it's wearing a soft ride boot on the contralateral leg, and that's to allow the limb length to be the same in both hind limbs. We're going to monitor the cast for noise, for cracks, for folds, for a smell. These cast materials are porous, so if there's pus or blood, it will come through the cast. And if we see stains on the cast, we're going to draw around those stains with a permanent marker so we can see whether those stains are getting bigger. Sometimes resisting the temptation to quickly take off the cast is really important. The biggest single indicator of a cast problem is lameness. That suggests that there's pain from the cast, irritation from the cast, and at that point the cast should be removed, and that's an emergency. But similarly, we don't want to take the cast off too soon, so really paying close attention to the animal is important. Generally speaking, animals that are wearing a cast will not require analgesia. They will not be given non-steroidal anti-inflammatory drugs, which might mask the signs of a problem under the cast. When you take the cast off, there will be exudate. The limb will smell. It's been covered for a number of weeks. The granulation tissue may be quite sensitive and it will certainly bleed, and the tissue will look inflamed. After 24 hours it will look a whole lot better, but the wound will be weak and it needs support. And look out for the how-to guide on how to encourage really strong scars. This is the wound of the animal with the extensor tendon laceration. You can see there's been some breakdown, but we've got a healthy bed of granulation tissue. And here we are just 4 weeks after that, where we've got that wound nicely healed. The lower wound shows a wound involving the fetlock joint, which was closed primarily under general anaesthesia, and a cast was placed. And this is at the point of cast removal at 16 days. So a nice wound which is closed, a nice scar, and that will do very well. We will often use casts to support skin flaps. You can see this skin flap here. It's being cleaned using hydrosurgical lavage, and more information about that will occur over the next few weeks. And this has been closed on the palmar or plantar, in this case, aspect of the pastern region, and then placed in a cast to support that. Again, if you don't immobilize this, this wound will break down. If you can immobilize that for 2 weeks, then the time that this animal will spend stabled and in some sort of a bandage or dressing is going to be much reduced than if you try and treat this either open or with dressings and bandages alone. Everyone should start their casting journey with casting of the foot, and I would urge you to go back and have a look at the how-to guide on foot casting, which is also in this how-to guide series. But here's an example of a wound involving the digital cushion, and you can see when the leg is lifted off the ground, this wound is closed, but when the animal bears weight, the digital cushion expands and the wound gets big and opens up. If you just bandage this, it will break down. Placement of 2 layers of casting tape, and then our thermoplastic on the bottom and some elastoplast on the top, and you can see this cast in place looking really nice. And this is the point of removal of the cast at around 14 days after the injury occurred. Starting and ending a cast in the middle of a long bone was for many, many years frowned upon, and conventional wisdom says it's dangerous, that this will lead to fracture. But in fact, this sleeve cast will work extremely well for wounds which involve the carpus or the hock. In this case, this is a sleeve bandage cast, which in this case stops the animal from flexing and extending its carpus. Here's a really good example of that being used. This is a cob riding school pony. It has this wound which is over the common calcanean tendon, the Achilles tendon. This was from a bandage rub sustained from a bandage that was applied to treat a wound which was in fact on the dorsal aspect, the front of the cannon bone. And this wound had been present for many months. This is a chronic wound that's undergoing complex and prolonged healing. It's affected by movement, infection, and of course not just movement of the area around the wound, but also of that common calcanean tendon, the Achilles tendon, moving up and down through the granulation tissue. And you can see that granulation tissue, it's a bit wet and it's a bit proud looking, there's hypergranulation, and it's being repeatedly traumatized. We opted to sleeve cast this horse as we considered movement to be the primary impediment to healing, and this is a sleeve bandage cast which was maintained in place for 13 days. So I want you to cast your mind back to this wound that had been present for many months, for 5 to 6 months, and this animal wore a bandage sleeve cast for 13 days, and then at the point that the bandage sleeve cast was removed, we had a flat bed of granulation tissue. So we've eliminated movement as a cause of the complicated and prolonged wound healing. In this case, we put some little grafts in, and there may be a how-to guide on grafting in due course, and you can see here we're 4 weeks after presentation. So a wound present for over 5 months, and then 4 weeks of appropriate immobilization and treatment has led to a wound that is healed. So in summary, movement is the most common impediment to healing in horses. It's safe to cover and immobilize wounds with a cast for 2 to 6 weeks. Immobilizing wounds to protect flaps and reconstructed wounds works extremely well, and the foot is a really good place to get confident and good at placing a cast. Cast horses, of course, have to be very carefully monitored, but casting is a simple and effective way to manage wounds, but you do need practice and patience. The information presented here is for illustrative purposes only and is based on our views and opinions, and not the opinions of anyone we work or may have worked for in any context. This series is not intended to provide veterinary advice. If you are faced with an injured animal, you should seek the advice of a veterinary professional in your jurisdiction. Thanks for your time and attention, and if we can help you at all with dealing with wounds, please don't hesitate to get in touch. Thank you very much.